Welcome back everyone, and in this video we are going to look at the preventative codes in our E&M section. So again, open up the front to your contents. If we go to evaluation and management, look at our table of contents, preventative medicine, page 47. Again, remember we can always go to the evaluation and management table of contents, which has more detail. Remember that there are 3 pages of these, and we can find our preventative medicine here, codes 99381 to 99429, page 47, and then we have all this more detail. For new patients, we have 99381 to 99387, page 47. Established patients, 99391 to 99397, page 48. Counseling risk factors reduction and behavior change intervention, 99401 to 99429, page 48. New and established patient, 99401 to 4112. And then it has preventive medicine, counseling, behavior change interventions, preventative medicine group counseling, other. So all of that is on page 49. So let's go ahead and open to page 47. So again, always start by reading the introduction, the guidelines here. So it tells us the following codes are to be used to report the preventative medicine evaluation and management of infants, children, adolescents, and adults. Remember, anything we see in green is revised this year, so that's all revised for 2021. One thing I want to point out here, it tells us if an insignificant or trivial problem, abnormality that is encountered in the process of performing the preventative medicine E&M service and which does not require additional work and the performance of the key components of a problem-oriented E&M service should not be reported. So what that is telling us is that we would not code an office visit with the preventative medicine unless it requires additional work, right? And at least a problem-oriented exam and medical decision making at a higher level. So when we look at the new patients, remember a new patient by definition is one that has not been seen by the physician or a physician in the same group of the same specialty within 3 years an established patient has. So preventative medicines codes divide based on new patients or established patients if we go to the next one. And then it also divides if it's an office visit for, age and gender appropriate history exam, counseling, guidance, risk factor, education, you can see all this, versus counseling, risk factor reduction, and behavior change intervention. That's a different section of preventative medicine. So is the patient coming in for counseling or really like a immunization check maybe, or some kind of annual exam that you might get every year when you get a well child check or a routine yearly exam? Those are going to be under the preventative medicine. So if we had a preventative medicine annual exam for a 45-year-old female, we would assign code 99386 if she was a new patient, right, age 40 to 64. If she was an established patient, it would be established patient, and age range 40 to 64 would be 99396. So when you're coding these, remember first you need to determine if your patient's new or established, and then the age is what is selected next.